Welcome back to Western New York Living. Living a healthy lifestyle is something that most of us strive for, but sometimes obstacles can get in the way. Having all of your medical records in one place and most importantly accessible to the doctors and nurses who treat you, very important. My next guest understands this better than most, and joining me now is Dr. Tom Schenk. He's the Interim Executive Director for Population Health Collaborative and joining us here this morning. Great to have you here, Dr. Schenk.
Thanks, Kevin. Great to be here this morning.
Well, why don't you tell us about the Population Health Collaborative and how it helps serve underserved individuals in their communities?
Sure. So the Population Health Collaborative is an organization that's about 20 years old in the community. It was started by the health plans and hospitals with the goal of improving the health and wellness of Western New York. It's gone through a lot of iterations, but in the last 3 or 4 years, our focus has been on an initiative called Live Well Western New York, which is a thing that's targeting kind of prevention as a primary thing, so getting people to stop smoking, exercise more, eat better, and then in doing so, having an impact on some of the diseases that make Western New York fairly unhealthy compared to the rest of the state. So that's heart disease and diabetes and that sort of thing.
And people get treated for those things. They see doctors, and that's where HEALTHeLINK comes in. And you have a new partnership with that to keep track of those records for those people. Tell us about that.
Yeah, absolutely. So I'm really excited that we've been able to sort of formulate an actual merger, moving the Population Health Collaborative into HEALTHeLINK. So we will become part of HEALTHeLINK in the very near future. And what that will do is bring all of those community initiatives that we try to work with the community-based organizations in doing really close to all of the data that HEALTHeLINK has. So really, for the first time, we'll have an organization in Western New York that is able to sort of partner with the community and actually measure whether we're succeeding or not in some of the initiatives that we're trying to do.
And you mentioned data, and that's where the data comes in that HEALTHeLINK has on diseases and how the initiative is if it's working or not, correct?
Absolutely. So, HEALTHeLINK is a great organization, also been around for almost 20 years, that's built this tremendous resource around health information and data in Western New York, mostly used only by doctors and hospitals to this point. But now, really, for the first time, we're going to have a very strong program that helps it relate to folks who are in the community trying to do sort of public health activities focused on those prevention things.
Yeah, and just talk about how having all those records in one place, how it helps the medical professionals.
Yeah, absolutely. So I think we're almost at a point where people take for granted when they go to the doctor that their doctor has the ability to see all of the other medical activity that they've had. So if they get an X-ray, the X-ray report is there. If they've been in the emergency room, the emergency room report is there. And I think people just expect that now, but that's not possible without an organization like HEALTHeLINK gathering all that data and making it accessible to other doctors.
How can folks take part or help out in the Population Health Collaborative? How can they be a part of this?
Yeah, I think we're gonna have a lot of information coming out over the next 6 months and the next year, really picking up momentum around this. And I think there's going to be a lot of opportunities for folks to work on public health in Western New York and making a better healthcare environment across all 8 counties. And the way you would do that is sort of listen to some of the things that are going to come out where some of the emphasis is. Look for organizations in your community that are working on those problems and figure out a way to pitch in. So it could just be making a donation, but it could be volunteering. It could be actually using whatever resources and career you have to kind of further the mission. So opportunities for everybody from school teachers to delivery people to lawyers and doctors.
All right, exciting partnership for both organizations and HEALTHeLINK, and it's going to result, I'm sure, in better health in our community. Dr. Schenk, thanks for joining us here. HEALTHeLINK is a collaboration among hospitals, physicians, health plans, and other healthcare providers in Western New York to securely exchange clinical information to improve the quality of health care for patients. To find out more, head to their website at WNYHealthyLink.com. Join the over 1 million people in our area using HEALTHeLINK today. Now, coming up next, are your pearly whites looking a little stained? No need to worry, because Power Swaps can help that in just 5 minutes. We'll hear more about their easy at-home teeth whitening applications when they join us. And after that, if you're planning on tailgating before the big game on Monday, and who isn't, then let the Market in the Square help. They are your one-stop shop for tailgating. Western New York Living will continue.
This segment of Western New York Living was sponsored by the following: